Hi, folks. Welcome, welcome. We're going to go ahead and give people a couple of minutes to get in and get settled before we get started this evening with our program. All right, good evening, folks. My name is Meg McElroy. I use she and her pronouns. I'm the manager of policy and advocacy special projects here at the AIDS Chicago. You are attending the wonderful Getting to Zero Illinois dashboard panel discussion and demo this evening. Couple quick housekeeping notes just as we get rolling. You should automatically have closed captioning turned on. If for whatever reason that's not a feature you'd like to, you can absolutely turn it off. Additionally, we have wonderful support from AFC staff on this event this evening, so feel free to go ahead and drop any questions or comments into the chat or the Q&A, and we'll make sure to get those to the right people during this conversation. So as I shared, I work at AIDS Foundation of Chicago, and I have the pleasure in my role there to advance the goals of Getting to Zero Illinois, which everyone on this call is aware is our state's plan to end the HIV epidemic in Illinois by 2030. So a little bit about the plan for folks who might be newer. The Getting to Zero Illinois plan was released in 2019, and it was created by people living with HIV, community-based organizations, healthcare providers, government agencies, and advocates, all to connect people who are living with HIV to care and achieve zero new HIV cases in our state by 2030. If you'd like to learn more about the plan, you can absolutely check us out at GTZ-IL-LINOIS.HIV. GTZ-Illinois.HIV is our website if you want to check it out after the event. And I know Jack will go ahead and drop that into our chat as well. So part of achieving any goal is setting performance measures and a system to track our progress. That's exactly what the Getting to Zero Illinois dashboard is for us. It's a one-stop data tool where we can monitor our progress to connect people living with HIV to care and achieve zero new cases across the state. The dashboard is the state's first ever tool that combines and displays publicly available HIV-related data in one place. It allows us to view specific graphs and that reflect individual communities and the communities that we serve. This specificity will make sure that we are getting to zero in every community because the state cannot achieve getting to zero without doing so in each county, each neighborhood, and each region. The dashboard was designed by Northwestern University in collaboration with AIDS Foundation of Chicago, the Chicago Department of Public Health, the Illinois Department of Public Health, the Getting to Zero Research, Evaluation, and Data Workgroup, and the Getting to Zero Communications Workgroup. Funding for the dashboard was provided by AIDS Foundation Chicago, made possible in part by a grant from the Pritzker Community Health Initiative and the Chicago Department of Public Health. I want to take a moment and just thank everyone for their partnership on this amazing project. Joining me today to have a discussion about how the dashboard will help us get to zero is Andrea Perez, who's the HIV section chief for the Illinois Department of Public Health, Alexander Martin, peer outreach and marketing coordinator at Central Illinois Friends and the Getting to Zero Illinois Communications Group co-chair, and Coleman Good, my colleague at AIDS Foundation of Chicago, who's the manager of community organizing. And he also serves as the Getting to Zero Equity Workgroup co-chair. After our panel discussion, we're going to go ahead and have a live presentation of the dashboard by Nanette Benbow, who is one of the lead creators from Northwestern University. So let's go ahead and get started with our conversation. For my panelists who are here with me, I'd like to begin by asking each of you to go ahead and share your pronouns with everybody who's on tonight, and then tell me one thing that personally excites you about the dashboard. And we'll go ahead and start with Coleman.
Hello, my name is Coleman Good. My pronouns are he, they. I think what excites me about this dashboard is where all this information, how it can really help activism and how it can really help me know and other activists where we need to do the work, what's missing. And so that's what excites me about this. I think it's a great opportunity.
Absolutely. Alexander?
Hi, I'm Alexander Martin. My pronouns are they, them, theirs. And I'm really excited because I'm passionate about accessibility and having resources available for everybody. And this is a very accessible platform for folks. And so I'm really excited to see how that works for our population going forward.
All right, and Andrea?
Hi, I use she, her pronouns. And what's exciting to me is that typically when people want information, when they want data, they need to reach out to us or CDPH or someone else and ask for that information. And then they have to wait while we compile it, pull it together. And now, although everything may not be there, a lot more will be available to individuals. So they won't have to wait for us, and they can, just kind of pick and choose what they need. And the data is just that much more accessible and hopefully that much more useful to them as well.
Absolutely. And I heard all of you talk about accessibility. Let's really get down to the nuts and bolts. What can the dashboard do? I think that's the biggest thing that people want to know. So what can the dashboard do?
So one of the things the dashboard can do is track several of the key points of the Getting to Zero Illinois plan, several of the goals and strategies. So you can see how many people are aware of their status, how many folks are newly diagnosed with HIV, how many folks are late diagnoses of HIV, those who are linked into care, those who are enrolled in PrEP, those who are virally suppressed. And these are super important because we know we can't end the epidemic without keeping track of things, without folks having access to the care they need, the resources they need, without helping folks who are negative stay negative with PrEP, without linking those who need care into care. And because it can display new HIV cases and other progress measures by age, ethnicity, race, gender, location, and more, we can do more targeted interventions. A lot of data sets are sort of blanket, like they'll be like, in the state of Illinois, this happens, but Chicago is different than Peoria, which is different than Springfield. Like region to region is different. Sometimes even county to county is different. And so, for example, like if we see in a specific area in Illinois that there's an increase in the number of late HIV diagnoses, we'll know that that area needs more testing, more resources for testing. Or if we see that there's a lot of new HIV cases popping up somewhere, that may be a hint that, oh, we need to do more PrEP uptake in this region. And so instead of getting this more overall statement of Illinois, we can get really specific and do targeted interventions that'll really help the community and be more specific and not just a blanket practice for everyone.
Yeah, I'd also like to say that we'll also be able to track people's progression along the lovely HIV care continuum. We'll be able to see how the number of diagnoses for people living with HIV, how many of them are linked to care, how many of them are engaging in the care, and how many people are retained in the care and are achieving viral suppression, which is what we want everyone to do. And this will also allow us to see if where we need to do that work, or why are people falling out of care, why are people not staying in care, and that will help us know where we can do that targeted intervention. The dashboard also has a great list of fact sheets that are created to show progress towards ending the HIV epidemic. It'll also show fact sheets on where we need to do the work, on where there's maybe disproportionately impacted people, like impacted by HIV. We know that Latinx, Black, gay, and bisexual and same gender loving men, transgender women of color, and cisgender Black women, and people all above HIV are also at the highest risk of HIV right now. And so we're able to have this place in the dashboard where all that information is available, and people can learn more about how we can use that targeted information to reach our Getting to Zero targets. And these fact sheets also help us understand the impact of the HIV epidemic on these groups and how it will inform prevention care that we'll be able to use to make sure that we are actively ending the HIV epidemic by actually doing work that's affecting that work. And we'll be able to see that in those fact sheets.
Another thing, Meg, about the dashboard is that it also features graphs related to the social determinants of health. the numerous factors that work together to impact someone's overall health, right? We know that whether someone is living with HIV and connected to care is also based on the proximity of healthcare centers, financial stability, access to education, and many more factors. So that's why the dashboard also measures economic stability, education, and healthcare coverage. It allows us, it shows us if a specific demographic has increased in new HIV diagnoses, but low levels of economic stability and access to health insurance that we might need to ramp up those offerings in addition to PrEP and targeted efforts towards that particular population. So in that way, the dashboard will also allow us to make targeted holistic health interventions. It's really only in addressing all of the factors that we can truly impact a person's health and that we'll be able to make that progress towards ending the epidemic.
Thank you all for those answers. I think the thing that you touched on, and this feels really important, this is a salient piece. I was listening to an EpiData presentation one time, and somebody talked about each data point is a human life. It's a person that we're talking about, and we need to really be cognizant and ground ourselves in that. And so I think a lot of times when we talk about data, that's the piece that's missing when we're having this conversation, is that human element. So I appreciate that all of your responses really centered that. That the reason we have the dashboard, in addition to accountability and all these awesome ways that we can visualize our data, is really to help people at the core of it. So in the dashboard, each data point represents an actual Illinois resident. When we're talking about data in the dashboard, we're really talking about these people, their lived experience, their lives. And the dashboard was also built by people. So let's talk about the who of all of this. Who created the dashboard? And how do we gather all of this individual information on residents?
So the Chicago Department of Health, along with my colleagues at the Illinois Department of Public Health. Wow, that was a flashback.
Andrea Perez came to us from Indiana. Illinois stole her away.
I did. They did. It's true. So anyway, we, the two public health departments, we collect and report surveillance data that provide a picture of HIV, AIDS, and STIs in Chicago and, the rest of the state of Illinois. Those data were released in static PDFs that weren't easily customizable. We couldn't, for example, easily identify HIV prevalence amongst 18 to 24-year-old Black, gay, bisexual, and same gender loving men on the south side of Chicago. But when we founded Getting to Zero, all the partners, including both the city and the state health department, realized that we would need a more customizable tool. In order to end the epidemic in the state, we need to know and be able to measure what's happening in each community. We can't end the epidemic just in Chicago. It has to be in every community. So that's why the health departments teamed up with a group of data scientists at Northwestern University to build this dashboard. The work actually predated me and began in 2019 and involved years of collaboration, fine-tuning, testing to see what would work, and a lot of back and forth between all of the partners. And finally, today, we're able to share what we've come up with the community. So a special thank you to Northwestern's lead dashboard creators, Nanette Bembo, who is joining us later tonight, and Gregory Phillips as well.
Absolutely. Thank you, to all of our colleagues who have really made this project able to happen. I think it's great that we've been able to collect this data and now make it really accessible for folks. Thank you. I want to go ahead and, Coleman, ask you a question. Can you help me kind of break down what can the dashboard be used for? So now that we have all this data, we have this really exciting way that we can kind of visualize it. What can folks go ahead and use it for?
Well, some of the things that the dashboard could be used for is to help inform our advocacy. For instance, we know that in the states as a whole, new HIV care are trending downward. However, that is not the case for each community and each demographic. We're still seeing higher rates of new HIV diagnosis among Black, gay, bisexual, and same-gender loving men, for instance. Now that we have a way to access data that showcases what we, what we know about on a community level, we'll be able to make better asks of our government officials, politicians around needed changes and additional funding at every level, state and local. And we'll also, so that we can support the ending of the HIV epidemic. Also, something else that dashboard can be used for is the myth busting of eradicating stigma, which remains barriers to testing and prevention in the state. Despite the increased information we have on HIV, it's still labeled as a gay disease by some. We know that getting to zero that Black cisgender heterosexual women are also disproportionately affected by HIV, but the myth that HIV only impacts the queer community has led to some, has led to some heterosexual residents to avoid conversations around HIV. Even with their doctors who can prescribe the daily medication and program for HIV negative people, PrEP. The data in the dashboard clearly busts this myth that HIV only impacts queer people and opens up the conversations around HIV for something that happens to queer people to something that also happens to other people. It's important that that shift is made so that prevention is a routine part of our conversation and not only reserved for certain populations. Another myth that still exists, most recently highlighted by the rapper DaBaby, yes, him, is the thought that HIV is a death sentence, which we know is not true. Because the dashboard allows us to pull data on the number of older adults living with HIV, we're able to have tangible evidence that people living with HIV can live long lives and healthy lives. It's also important that we bust that myth and eradicate stigma overall, really that enables us to get to zero.
And that point was,
yeah, I want to come to you. And, you know, I think Coleman has a certain lens with the work that Coleman does. I think you absolutely bring a different lens. So what are some other ways that folks can kind of utilize the dashboard?
yeah, so like stigma is a really important point that Coleman brought up. I am a test counselor. I work with patients every day, like day to day. They come in and out of our office. And that sort of helps me see some of the myths that get spread around our community and some of the people still they have no idea how far research and prevention and care has come in HIV. And so there may be other things that folks need, but people aren't always going to be honest during a test counseling session. They aren't always going to open up to me because of that stigma. Like stigma is a huge barrier, and they still think that only certain populations are going to be affected. And so this lets me see what's actually happening in my community, and I can get a better insight into folks who may need a little bit more attention, folks who may need more care if they don't feel comfortable opening up during our session together. When they come to get our services, I can still see what I can do to better impact folks in my community by looking at this data. Something else that's exciting is the graphs are downloadable, which, like I said earlier, accessibility is really big for me. So that's a huge support for organizations like mine if we're applying for grants and funding. Like, again, we have to usually use state data that's dispersed everywhere, but now I can print off a graph specifically from the region I work in, the city I work in, and what's happening there, and say, hey, this is an issue in our community. We need to put this in our grant application. For a lot of organizations, especially organizations downstate, it gives them a platform to data collect. It makes it a lot easier and a lot more accessible for folks. And you don't have to be an expert in data collection and research to do this for your own region or own city. Also, like you said earlier, I'm a co-chair on the Getting to Zero Illinois Communications Workgroup. And like everyone has been saying, each of these data points is a person. Each of these things is a human in our state that is either living with HIV, accessing care linked on PrEP, any of the things listed above. And so this is a great opportunity for storytelling. Journalists, bloggers, storytellers, folks who are media facing will have data that's easily accessible to write about. As someone who has written articles before, it can be hard to find up-to-date research that's not from 3 decades ago. And so having this update going on, having this data available and accessible, folks can access that and have that data included in their writing. They can sort of disperse to the public what's actually happening in our state. So I'm really excited to see what stories come from this.
I want to take a minute before I hand it over to you, Andrea. I want to take a minute. Jack, if you would be so kind, Alexander has written wonderful blog pieces for Getting to Zero blog. And if you could just drop the link in to give some props to the wonderful kind of articles, the work that's done on our blog. I think we're here to highlight the dashboard today. We have so many amazing projects going on with Getting to Zero as well. All right, Andrea, coming to you. What ways are you excited for people to be able to go ahead and use the dashboard?
I think the only thing I'd add to what Alexander and Coleman already shared is really something we've been talking about since we've been here, is that the dashboard will illustrate exactly where the needs are and exactly what those needs are, you know, in a specific way that will allow us to better do that targeted intervention. I think, you know, we knew on a ground level what was happening in our communities, but this dashboard really gives us a way to take our efforts to the next level and to look at things in a way, you know, a way that is different enough that I think will really impact our Getting to Zero efforts in a different way.
Absolutely. I want to return to something that Coleman had said a moment earlier about advocacy. I work in an advocacy department. And so the data presented in the dashboard can absolutely support advocacy and other efforts. But there's also data that's not going to be available within the dashboard. So let's take a moment and talk about some of the limitations of the dashboard. We think it's amazing. I think so much work has gone into it, but just like any project, there are going to be some limitations. So how can that also be used to inform our advocacy as well?
Yeah, so like you were saying, not everything in the GTZ plan is measured in the dashboard. It's an almost the barriers that people have to care and accessing resources, it's almost impossible to list all of them. There's so many. And for some areas like housing for people living with HIV, there isn't data collection being done in a way where we could fold that info easily into a dashboard. I personally get confused if I have to add one more axis to a chart to figure out what's going on. So adding things like that aren't easy to document and easy to get consistent data on can't be put in there. So the dashboard only showcases the data currently being collected that we have access to, which were those points we said earlier.
I think another thing that's important is that there are certain things that we as the state and the city of Chicago as well cannot report out on due to privacy concerns. And, you know, as you mentioned earlier, Meg, and I'm sorry, I can't remember if it was Alexander or Coleman that mentioned it as well, but that each of these data points represent a person, they represent a human being. And, you know, in our zeal to, you know, to do good work and to work with the data and to make data available, we still have to protect those individuals. So we want to be sure that we're, you know, we're sharing and reporting out as much as we can, but at the same time, we don't ever want to infringe on an individual's right to privacy.
Yeah, and I'd also like to add, you know, the lack of some of the data point really opens up the conversations for active community activists like myself. If there's information not presented in the dashboard, that would be helpful for, you know, our communities, especially people living with HIV. We can start advocating on the city and state level for that data point. We need to collect more data. We need to collect more data so that we can more effectively target and help those communities. For instance, we know that data collected by the city and local and state, but the city and state on transgender residents is limited. And as a result, the data presented in the dashboard on transgender people is limited. So how helpful is it to know on a specific level where the needs are to inform what we do next? Without adequate data on groups we prioritize, we're not able to support them. We're not able to support those residents and with the same level of targeted support that we are with other residents, other people. Because like someone says, these are people we're talking about. These data points are people. And since the dashboard will be updated for years to come, our advocacy for more data collection hopefully will change what's reflected in the dashboard and giving us more tools to end the HIV epidemic.
Thank you all for those really insightful responses. So I want to pivot a little. A huge part of Getting to Zero is addressing racial equity. We know without addressing racial equity, we won't get to zero for all of our communities throughout the state. So racial equity is an essential element and focus for us for the plan. Because we know from the data, rooted in the data, that the HIV epidemic is largely impacting Black and Brown communities. So how will the dashboard help us combat racism and achieve racial equity?
Yeah, so this is my jam. This is where I get excited. You know, at a community level, we've known for years that there have been inequities within the HIV epidemic. And the data continues to show us that. It continues to, well, that actually, we have that accessible that also underscores this though. Because we know that the dashboard that is customizable to excuse me, but we also, because we know we have this dashboard that's customizable for specific, based on a variety of demographic factors, we can continue to see which groups are being impacted by HIV epidemic and to what degree. We have our priority populations, as I talked about earlier, our Latinx community, Black, gay, bisexual, same-gender loving men, HIV, cisgender Black women, Black transgender women. And so we understand that all of whom are people of color. The dashboard will allow us to identify what specific resources and support these groups need. That might differ from neighborhood to neighborhood, and that might differ from based on age. That to achieve true racial equity, we have to be able to help our residents of color reach the same playing field, to have access to PrEP, testing, care, economic stability, and also health insurance and more.
And like, that's really important for me personally. Like, I live downstate. I'm a trans Black non-binary person living in central Illinois. I know my needs and the needs of the clients I see and serve every day. And I know that they're different than those of folks that live in Chicago. Like, I even get clients who move here from Chicago and like having to adjust to the different resources that we have here as opposed to up there. And so because there's different levels of access to resources, I think this will help document that. It'll help show gaps. It'll say, like, I mean, you could say till blue in the face, like, we don't have this in region 2, or we don't have this in region 3, or we don't have this in this city. But now we have data to show, okay, so the barriers, there's some real barriers being seen here, and we can see these numbers. We could see increases in these cases, or we could see lack of linkage to care, or we can see whatever. There's something we need to address in that area. There's something we need to address downstate. And it's like, when we're able to tell, not just tell that story and speak our truth, but support it with data, because unfortunately everything is data driven. So if we can tell our story but support it with data, we'll be able to better advocate for equity, and also work towards it. And so in doing so, we're able to not only end the epidemic but achieve racial equity as well, which is just, it's awesome that with the accessibility of the dashboard, we can use that to back what we know is happening, but then we can have the proof to say, we need to fix this, we need to work on this.
Absolutely. And that brings me kind of to my next point. And Andrea, I want to come to you about this. So when we talk about equity, we also, in the same exact breath, are talking about accountability. That, like, we can't achieve equity without being accountable to all Illinois residents. So Andrea, how will the dashboard help hold Getting to Zero, the city of Chicago, the state of Illinois, accountable to making progress in ending the HIV epidemic?
So when we created the plan to end this epidemic, we created several goals that have, in this time, lived on the Getting to Zero Illinois website, which, by the way, is GTZ-Illinois.hiv. If you haven't checked it out, please do. But so now we have a way to measure progress on several of those goals. So that allows us to hold ourselves accountable to making progress on the goals that we set. It's also a tool that the community can use to hold us accountable to ending this epidemic in each region, each community, and different demographic groups. GTZ is a statewide initiative for a reason, because although, as we were just talking about, the needs may be different, in all parts of the state, we need everyone just for that reason. We need advocates, providers, people living with HIV, government agencies, anyone else who will come and help us. We have to hold one another accountable in the progress that we said we were going to make in achieving equity and ending this epidemic.
Absolutely, absolutely. All right, well, I know that we have done a lot of talking. I appreciate Coleman, Alexander, Andrea, all of the insights that you've brought on this. I bet our audience is very eager to see the dashboard. So I'm going to go ahead and let Nanette Bembo showcase the dashboard. Nanette is the research assistant professor at Northwestern University, and Nanette created the dashboard along with Gregory Phillips, and a team of data scientists over at Northwestern. So Nanette, please go ahead and take it away for folks.
Great. And thank you to the panelists for paving the way for the dashboard. I'm very excited about the dashboard after this conversation. So hello, everyone. I'm excited to be highlighting today the Getting to Zero dashboard with over 70 graphs presenting numbers and trends of key indicators to provide a comprehensive understanding of our progress in reaching GTZ goals in Chicago and Illinois. These graphs are designed to allow you to select demographic characteristics so that you can visualize the impact of these indicators on the communities most affected by HIV. I will now share my screen to walk you through the dashboard. Okay. So you can access the dashboard. How do you get there? You can access the dashboard by going to the Getting to Zero Illinois site, gtzillinois.hiv. And there's a link at the top of the navigation bar, GTZ Illinois dashboard. And this brings you to the home page. The data in this dashboard are organized in 3 different sections, which you can access here from the navigation bar. Progress measures, which display graphs for these 7 indicators that have Getting to Zero 2023 and 2030 targets. Health measures, which present data on the health status of people at risk for or living with HIV. And social determinants, which Andrea mentioned, which display social and environmental factors that the GTZ plan highlights as factors that impact HIV-related outcomes. You can also access the data. In addition to these links, you can access the data by clicking on the links here for progress measures, here for health measures, and here for social determinants. We wanted to make it as easy as possible for you to get to the graph that you want when you want it. If we go to the progress measures, we can see by looking at the graphs below for the 7 indicators, if you look at them, the GTZ plan started in 2019. That's our baseline, and that's what we'll be comparing our efforts to, and our progress towards the 2023 and 2030 goals. So if you go through all of these graphs, you'll see that in many of these graphs, if you compare 2018 and where we're at, you can see that we've made some progress in some of these indicators. And for others, we still need a little bit work to achieve them. So for instance, if we click here to Illinois, and you will use this toggle throughout the dashboard to be able to select whether you want to look at data for Illinois or Chicago. So here I'm going to go to Illinois. And if we go down to the linkage to care indicator, right here, we see that in 2019, the most recent data point that we have, 80% of people newly diagnosed with HIV are linked to care, which is very close to meeting the 2019 annual target. If every year moving forward from 2019 to 2023, we reach the annual target, we can achieve the 90% target of 2023. For viral suppression, however, if we go down to the viral suppression indicator, we see that while we've made considerable gains from 23% virally suppressed in 2010 to 53% virally suppressed in 2019, we still have, we fell short from the 2019 annual target. And this indicates that further efforts are needed to increase the percentage of people who are virally suppressed in order to be able to reach that 2023 target. Increased efforts may be needed at different levels for different populations, as our panelists clearly articulated. You can identify which populations might need more extensive care and support services to increase viral suppression by selecting the Interact button. So this shows our progress in viral suppression, where we are in meeting the targets. And if you select the filter option here, we can see the changes in viral suppression for these different populations. If we select race ethnicity, for instance, we see that, so you can see, we see that non-Hispanic whites need less of an increase in percent virally suppressed than non-Hispanic Blacks or Latinos. And I'm highlighting these points, and you'll be able to do this throughout all of these graphs. If you hover over the points, you'll be able to get the demographic group that you're looking at, the value, and the year at what you're looking at. So while some groups may be doing better than others, you can see that collectively these groups still have a ways to go to our 2023 target of 77% who are virally suppressed. I'm now going to turn to our health measures, which include indicators regarding prevention, diagnoses, prevalence, care and treatment, deaths, and priority populations. You can select any one of these links to view multiple graphs for each of these areas. Now, many of you are probably familiar with CDPH and IDPH surveillance reports, and you'll recognize many of these indicators, but the dashboard provides some significant enhancements. So I'll just highlight a couple of them. So for instance, if we go to diagnoses, and we go to new HIV diagnoses, you can see here trend data that illustrates the progress we've made. In this case, we're looking at Chicago, the progress that we've made over the last decade, really promising. We can also observe trends for selected populations like we did before. So for instance, we can look at race ethnicity groups, gender, age categories, and transmission category. If we select, for instance, gender, you can see that we have data available for several groups: cisgender men, cisgender women, transgender men, and transgender women. And we're really happy to be able to systematically be able to present data for these populations, because as the panel mentioned, providing data for these populations empowers and helps us target needed services for them, depending on their needs. Here we observe declines in new HIV diagnoses among cisgender men from 814 in 2010 to 533, and cisgender women from 169 to 100, but stable number of new diagnoses, relatively stable among transgender women. If you then select in the second category, age, we can see which age groups within these gender categories are experiencing higher or lower level, lower number of new diagnoses in the last 5 years. In addition to these line graphs, you can also select up here the type of graph that you want to look at, and we have percent distribution graph. And this helps you examine changes in age distribution over time for each of these gender categories. So for instance, if we look at trans women and we're looking at age 20 to 29, we see that transgender women between the ages of 20 to 29 account for at least half of new diagnoses every year for this group. These data help us understand where we need to focus our effort to reach the getting to zero target of 100 new HIV infections in Illinois and 54 new infections in Chicago by 2030. And those goals we want to reach to try to get to a functional zero. But given our overarching goal to achieve 95% viral suppression by 2030, a very ambitious goal, We will need to understand how well people are moving along the care continuum after diagnoses. So these graphs have told us how many people are diagnosed and how that's changing over time. So how well are we doing then on the care continuum? So let's go now to the care and treatment section. And here we can explore a number of graphs. We can explore the HIV care continuum for people living with HIV, for people newly diagnosed with HIV. We can look at trends and continuum indicators for people living with HIV and newly diagnosed. We can look at days from diagnosis to linkage to care, to viral suppression. And we can look at these continuum indicators for different geographic areas. Here we're looking at Chicago, but if we select Illinois, we can also be able to look at these by counties in Illinois. So now I'm going to select one of these. So if we focus specifically on HIV care continuum among people with HIV, and again, I just want to show this example of how you can get to both jurisdictions, because I know we'll have groups that will want to look at both of these. Within this, once that we're in the HIV care continuum for people living with diagnosed HIV infection, here we can select and look at care continuum for people living with HIV, for people living with HIV that are engaged in care. So these are people, they've touched care, they've made at least one visit. Well, how well are they doing in viral suppression? And then those that have been recently diagnosed with HIV within the last 5 years. So you might think that people who are diagnosed recently might have a different sort of care cascade than those that have been living with HIV for a long time. So you're able to look at all of these. So if we just look around people, overall people living with HIV, we see that 66% of them are in 2019, and you can select years here, 66% of people living with HIV in 2019 were engaged in care. 42% were retained in care, and 50% are virally suppressed. If you select the age category, for example, say you select 30 to 39, you can see a slightly different cascade for this age group. A slightly higher proportion are engaged in care, 41% are retained, and a slightly higher percent of viral suppression. But then maybe you might want to look further and maybe look at a specific race ethnicity group. So you could go to the second category, select race ethnicity, and say, for example, that we select Hispanic Latinx. Here we see that, there we go, that 66% are retained and are engaged in care, 42% are retained in care, and 55% are virally suppressed. So I don't want you to remember all these numbers. I just want you to be able to see how you can get very specific HIV care continuum indicators for the population that you're interested in. Again, these data can help us understand the steps where we need to intervene to help this particular group, for instance, reach the 77% by 2023 and 95% viral suppression by 2030. Now, some of you may be thinking, well, the GTZ plan not only aims to increase services for people living with HIV, it also has a central focus to increase prevention services for those at risk. So let's look at PrEP, for instance. How well are we doing? So let's go back to our progress measures. And here I'm going to select Illinois. And let's go down to PrEP coverage. So if we look at this graph, we can see that we have made considerable progress in increasing the percent of people who have an indication for PrEP that have been prescribed PrEP, from 19% in 2017 to 31% in 2019. But still, the 31% again is a little bit lower than the mark that we are expected to reach, 35%, if we have a linear increase to our 2023 target. So to achieve this target, we need not only to increase PrEP prescription among those who are eligible, but we also need to ensure that those at risk of HIV are aware that PrEP can help them prevent infection. So to get a sense of how well we are doing on this front, we can go to our prevention measures. And we can examine PrEP awareness. Based on data available from a surveillance project for Chicago, and this data is only available for Chicago given that this project only exists there, we can see that PrEP awareness has increased among heterosexual women from 4% in 2013 to 37% in 2019. We select people who inject drugs. We also see an increase in PrEP awareness from 11% in 2012 to 27% in 2018. And among men who have sex with men, where the PrEP awareness has increased from 33% in 2011 to 86% in 2017. So we've observed increases in all of these groups, but different percentages within them, among them. Now, we could also look, say you want to look at, okay, within men who have sex with men, how is that faring for different race ethnicity groups? Overall, again, we see an increase over the 3 years, but we don't see increases for all groups. Again, we can see here a sort of a variation in the percent aware in the most recent year. And that means that for some race ethnicity groups, and you'll probably observe this for other categories that you look at, we'll need targeted and tailored efforts to increase PrEP awareness that is meaningful and reaches these populations. So this concludes my brief highlight of the dashboard. The graphs I have shown you thus far help illustrate how you can approach looking at the data to understand where potential services and interventions are needed to reach GTZ goals and identify what populations are needed for them. Meg, I'm going to present a couple of more things. Sorry, I sent you a cue. Nice to see your face though. But we can also provide data that can help you explore social determinants of health, as Andrea mentioned, and fact sheets for getting to zero priority populations. So we're really excited about this. We think it's really important to provide this data, and I just wanted to highlight that for you. So if you go to priority populations, you'll be able to find for Chicago and Illinois specific fact sheets for Black MSM, young Black MSM, people over the age of 50, Hispanic Latinx MSM, young Hispanic MSM, transgender women of color, and cisgender Black women. And you'll be able to see these for both Illinois and Chicago. And speaking of the importance of geographic differences, we also have one for the Chicago eligible metropolitan area. So let me just highlight one of these. So if we look at Black MSM for Chicago, what you have here is all the different graphs that I showed you for this population. So you're able to understand exactly how the epidemic has impacted this population, what the characteristics are, what is the age distribution, what proportion of new diagnoses they account for, late diagnoses, all the graphs, many of the graphs that we have here, the HIV care continuum for this population. And lastly, how well we're doing on the progress to GTZ targets for each one of these priority populations. So we'll be able, right now we're comparing our baseline to the data that we have, which is 2019. But as our panelists mentioned, this will be renewed, this will be updated every year. So little by little, we will be looking at data for 2010 and 2021, 2020, 2021, et cetera. And we'll be doing that as data becomes available. So I have really only scratched the surface of all that you'll be able to explore to understand the HIV epidemic in Illinois, Chicago, Illinois counties, and Chicago community areas. My presentation was quick, and you may want to know more about how to navigate the dashboard. So you can go to using the dashboard for more information, and we have there a short video that will show you the sort of how-tos of the dashboard. And if you have questions regarding the data sources, how did you get this data? What does it mean? You have all the detail you want here in data definitions. So we hope this dashboard will help answer many questions and generate new ideas on directions needed to achieve the goals of the GTZ plan. Gregory Phillips and I, as the co-directors of the project, would like to thank our amazing team of Northwestern staff who helped build this very complex dashboard. Many of them are here, and thank you to you. CDPH and IDPH, who worked really hard to provide and validate the data. I can't thank them enough. And all of our collaborators and partners who provided feedback to make the dashboard user-friendly and meaningful. We recognize that, and this was already addressed, we might not have all the data, or there can always be improvements made to the dashboard. So we have created this short survey, which we hope many of you and our users answer, so that we can better understand how we can improve our dashboard. We hope to improve it. We know it can be improved. And with the rich sort of diversity of people using the dashboard, I'm sure we can make it much better. You can also use the contact us below if you want to ask any questions or share suggestions. So I think that's it for Magni. You can come back.
Nanette, I was just so excited to jump back on. So I appreciate you being able to go through the fact sheets. I think they're a really cool part of the dashboard and a unique part of Illinois' dashboard specifically. I want to give you a huge thank you for walking us through the dashboard. I know it was brief, but it was very exciting to see kind of all of our data come to life and all the hard work put into it. So thank you for presenting. I have seen a couple of questions come in the Q&A. I want to go ahead and hear from our colleagues, partners, guests who are on this evening. What other questions do you have about the dashboard? What do you want to know? What do you like? What's exciting for you? Please insert any questions that you have in the chat or the Q&A. The first one, though, that I want to go ahead and throw out there, I know at the top of our program tonight, we heard from Coleman, Alexander, and Andrea about what was exciting for them about the dashboard. Nanette, and I know Gregory, you're on as well. I'd love to hear from both of you, or somebody would like to hear from our audience, but I would also like to hear, what is the thing that you're most excited about for the dashboard?
Is that for me and Gregory?
For you and Gregory, yep.
Oh, well, Meg, thank you for that question. I'm sure Gregory has a lot to say as well. I'll just jump in. I think, as you know, I was an epidemiologist for the Chicago Department of Public Health for 14 years. And my job was to actually produce this data. So when Andrea said this dashboard will help make data available more quickly, more extensively, and people can get it quickly and provide less burden to health department staff, it does that. And I think, you know, as an epidemiologist, I also had to present this data, and people really got excited when they saw a good graph, and they would go to sleep when they saw a table. So I'm excited. I hope that this brings excitement and understanding to the epidemic, which isn't always easy, and increases the use of these data.
Gregory, what's most exciting for you about the dashboard?
I'm really excited to hear how people are using these, see how people use these, see these pop up in presentations and grant submissions and talks. We've put a lot of work into this. We've gotten a lot of feedback from the community and from everyone on this panel and on this call about what works, what looks good, what is exciting about this. I just want to see these actually being used, because that's the whole purpose of this project. So that's what's most exciting about me. And I think Also, the ability for some of these cross tabs that we haven't been able to get at before, for actually being able to answer some of the questions, concerns in the community about being able to look at finer points within the data. I think actually being able to address questions from the community that we can see in the data, I think is really going to be exciting.
Awesome, awesome. So we got a question from an audience member. Does the Illinois data and statistics include Chicago too?
Great question, and the answer is yes. We thought it was important that the GTZ plan is for a lot of jurisdictions, but it recognizes that the state needs to mobilize all its different components to be able to reach that goal. So we thought it was important to have a statewide picture. So yes, it includes Chicago, and as many people mentioned, we have a lot of data for individual community areas and counties.
Another question that we got in, are other states or jurisdictions, do other states or jurisdictions, especially states who are doing EHE work, do they have dashboards like this? Or is Illinois kind of in uncharted territory? Are we kind of leading the way?
You know, I am aware of one of the New York City. It's called Ending ETE, Ending the Epidemic, New York City, I think, or New York State. That is the only one I am familiar with that is out there now. But you know, it always helps to see what's out there and then to see what more you can bring to it. And hopefully as more dashboards come, they will become better. The cross tabulation is something that is not present in that dashboard. And as Gregory said, it really is our only way to be able to represent all the communities that are affected by HIV. So we're really excited by that. And we also have additional indicators that are new to this. So I think we're still kind of quite new in the game.
Absolutely. Hopefully we'll be able to be a resource for other states who are earlier in their the HIV epidemic work. So I look forward to that as well. That's something that I'm excited about for our dashboard. Yeah. Another question that we got, somebody said, "Hi, I'm a writer. I heard someone say anyone is welcome to use the data. I just wanted to confirm, are the graphs something I can use in my stories?"
Absolutely. Absolutely.
And if somebody wanted to go ahead and use the graphs or any of the information in the dashboard, how do they know how to cite back the information that's presented? Because as we've talked about, there's so much information from many different sources. How are we going to go ahead and give credit kind of where credit's due and make sure that people are able to get back to kind of our original data source?
Thank you, Meg. That's a great question. In the using the dashboard tab, I believe at the bottom we have a suggested citation. And all of our graphs have footnotes. I recommend you all read them because they help explain the data that you're looking at. We also have sort of, you know, how to specifically cite the sort of the visualization and then the getting to zero dashboard. So you can find that in using the dashboard.
All right, and the final question that I have, so feel free folks, if there's other questions, this is your last call to drop them in. How often will the dashboard be updated? And is there a specific time that we can kind of look for updates for this?
Yeah, that's a great question. We will certainly be updating it. You know, we right now we're thinking, and again, it's something that we have to discuss with the health department since they provide the data and are very familiar with when the data is ready for us to use it. But we're thinking it's probably going to be around the end of the year or the beginning of the year every year. So stay tuned. People will get notice and we will reach out to you.
Awesome. Well, I just want to take another moment to thank all of our panelists this evening for connecting with us, as well as Nanette and Gregory for presenting on the dashboard to folks. Please go ahead and, as Nanette shared, there's many ways to kind of share your thoughts, your experience about the dashboard right there on the dashboard itself. So we'd love to continue to hear from folks, especially as they navigate through this really new and exciting tool. I want to thank,
I did see there is an extra question if we have a minute. I think
Oh,
someone
sure.
was asking, and this can be developed into an app in the future.
Mhm.
That is a great question. We probably need to noodle that, but I do want to say that this, another thing that we tried to do that's different from the other dashboard that we know is we really tried to make it mobile friendly. So these graphs are, well, not quite an app. You can see it on your mobile phone. There's some functionality that you might not have, but I think if you're in a pinch and you want to look at something, you can also access it on mobile.
Thank you so much, Yvette, for sharing that. And yeah, that's really exciting. I was able to be part of the kind of first test of folks, and I did it on my phone, and it looked equally as awesome. So yeah, very cool that we were able to access it kind of on the go or in front of your computer. All right, folks, I want to thank everybody for joining us tonight, especially our audience. It's so wonderful to have you here to learn more about the dashboard. Our conversation tonight is coming to an end, but the work of the dashboard is not. So we hope that everybody kind of gets on there, checks it out, pokes around, looks for information. The dashboard is now officially live. You can visit the dashboard at, I don't want to screw this up, so Jack, drop it in the chat for me. Visit dashboard.gtz-Illinois.hiv to explore the dashboard more. There should be a pop-up box that takes you right to it. Also, you can visit getting-zero-Illinois-dashboard-resources, lots of dashes in there, to find additional resources, including a one-pager about the dashboard, as well as social media posts in both English and in Spanish. After you've had the chance to check out the data, please let us know your thoughts. Feel free to email Getting to Zero Communications Bailey Williams, who played a huge role in tonight's event. Thank you, Bailey, for all the work and effort that you've put into this. You can reach Bailey at bwilliams@aidschicago.org. I hope you all have a wonderful night. It's been great to be able to spend time with you, and we look forward to seeing you all in the future.
Bye all. Thank you.
Bye.
Okay.